So, Dr. Kevin Winters, tell me how you almost became a Dallas Cowboy.
Actually, that was probably more in my mind than in actuality. But it was one of those things growing up that it seems like I was always very interested in sports and athletics and football. And growing up in the Midwest, that's football is the thing. And at the time, I was just felt connected to the Dallas Cowboys. And so as a result, I mean, I kind of went overboard. But as a kid, I could tell you statistics about every player, where they're from, what they did, all this kind of stuff. I mean, it was a deep dive into everything Dallas Cowboy. But, in actuality, it was, like I said, it was probably more of a dream than anything else. Played multiple sports through high school, played college football at Kansas State. Once I was there, the leap from high school to college is tremendous. It's completely different game. But the leap then forward from college to professional is a whole different level. And I realized that I wasn't that good, no matter how bad I wanted to be. But that's also the time that I realized, academically I was doing pretty good and had a chance maybe to go further academically, and it kind of felt this interest for dentistry as a profession. And so it got to the point where it was just a realization that, hey, my football career is pretty much over. I need to look at big picture and what's going to take me, into life. And that definitely was the choice to go into dentistry.
And tell us about neuromuscular dentistry. And does that differ from being an airway dentist, or are those synonymous?
Well, yeah, I mean, they're different, but they're very interrelated. Okay, so in dental school, even currently, certainly when I was there, there's really no mention of anything about neuromuscular dentistry, because what we're talking about there is the relationship of muscles and nerves and how that affects things that go on with your jaw and development of your face over time. And traditional dental teaching tells us nothing about that at all. It's teeth and bones and angles and very hard tissue structured stuff. I mean, one of the things that's related to the jaw in particular is, I mean, we're basically all taught that your jaw moves like a hinge on a door. Okay, you open the door and it hinges one way and closes, it goes back the other way. But if you feel your jaw, when you open and close your jaw, it doesn't do that at all. In fact, there's an interesting test that if you put your first finger in your ear with your teeth closed and then just open, the first movement that you feel is your jaw moving forward. So that right there changes your concept of this hinge movement to something that actually translates forward and hinges at the same time as it opens. But all of dentistry and all of joint teachings and occlusion teachings that have to do with the movement of the jaw center around this hinge axis movement, which is false from the very beginning. But it's also interesting in that the formal teaching of occlusion and jaw movement and stuff, when you're going through dental school, it's made to be like this almost, this mysterious thing that only a few people really understand. And, maybe you as a student can get some of the concepts, but some of the things they teach you, they don't make sense. No one can do it. No one can, you're not the gifted master who's teaching all this stuff. And so occlusion and jaw movement just kind of gets put on the back burner. You get out, and dentists that are now actually out in the field and working and seeing patients most of the time, when there's something jaw related, they say, here, go get a night guard and put it in and you'll be okay. Which is really nothing more than, I don't know what to do, so put this in there and maybe it'll work, maybe it doesn't. I don't know where to go with this. And that's the majority of dentists now. That was me until I learned better. But that's a reflection of the educational part of that for all of us up to this point. So neuromuscular dentistry then is almost the antithesis of that. It's saying that I really don't care that much about teeth and bones and, that kind of stuff. It's more about what are the muscles doing in movement? How do the nerves initiate the muscles to make these changes? What's the proprioception of things once the movement has happened? And then once you take that into consideration, you can simply make all the puzzle pieces fit wherever that location is. Because no matter what happens, your teeth coming in together, wherever that is in a person's bite and structure, is dictated by a multitude of things that go back to birth. And it starts this just line of action and result from the very beginning that forms your face and forms where your teeth meet. And the majority of that has nothing to do with the muscles. The muscles have to accommodate that and close your teeth together so you can chew and swallow and things like that. But they weren't really asked their opinion of things. They were dictated by the growth and formation of the bones and then where the teeth meet and have to accommodate to that position. But then that is, in turn, what leads to so many symptoms related to TMJ problems. So we've found that although the focus sometimes gets put on what's happening with the teeth are simply a symptom of this other issue that's not so easily seen, but is really the driving force for the problems. So then your goal as a neuromuscular dentist is to identify what that issue is, what the muscles want to do, how that coordinates with how the teeth function in an effort to become symptom-free, to get rid of a multitude of different problems that this TMJ or TMD problem can create, and do so in a way where things are pretty predictable now. I mean, if you follow certain protocols that we have, it has become fun to do, and it's taken a lot of the anxiety away from treating crazy TMJ patients, which we were all taught everyone is. But again, that has to do with you don't know what to do with them. So they're nuts. It's their problem. It's not me. And instead of, I need to learn more about this so I can help these people. So long story here around back to the original question. So neuromuscular dentistry focuses really on muscles and movement and things like that. Airway-driven dentistry is more about, you just got to breathe. How can dentistry be a part of helping someone breathe? And again, it's very multifaceted. Again, going back to, and as so much of this does, what's happening as an infant, as a child? What about the formation of the skull, and how do you create this airway problem down the road? What's led to this? You just didn't wake up one day and have this problem. It's an evolution over time of the realization that you're not breathing well. And so the airway focus in dentistry can disregard some of the neuromuscular concepts, but neuromuscular concepts always consider airway.
Oh, okay.
Okay. So there's different ways of trying to help airway issues in dentistry, but it has nothing to do with the response of the muscles. Okay. It's just simply, how can I get the airway larger so you can breathe better, irregardless of anything else? But what happens many times in those situations is it can actually create other problems because they weren't addressed from a muscular standpoint along with the airway opening process. So yeah, they're related, but different at the same time.
Okay. So in my case, and for those listening, a lot of the stuff we're going to cover is based on my subjective experience of working with you and your team at the Hills Dental Spa over the past, I don't know how many months. I feel like I'm finally done now. I'm scheduled for my next cleaning in a couple months or something, but I'm like, we went through a major reconstruction, and what led to that was, I think, who knows, and maybe you have some insight into this in terms of, what happens at a birth, if a baby is using a pacifier or is breastfed or is tongue-tied, and some of the things that lead to this. But essentially, I think what my situation was that I had some airway obstruction throughout my life, and thus would clench and grind my teeth at night when I was sleeping, and just wore down my teeth to dysfunctional nubs. Really, like I could barely even chew a steak. It's like a huge project. And I'd always gone to, well, not always, but in my adult life, gone to biological dentist, and made sure I got my mercury fillings removed, and we weren't using any toxins, and we were using biocompatible composite to fill fillings,
which is all important stuff.
Yeah, and then I reached a point, even with doctors Nunnally and Owens out here in Marble Falls, who are great at that type of dentistry, and kind of reached a point with them where they're like, you've hit the threshold of how we can help you, because you basically need all crowns and veneers, like your teeth are just gone. And their strategy to a certain point was, well, we want to keep as much of your original organic tooth matter as possible. We don't want to keep drilling and filling until you have nothing. So I kind of hit a wall there. But it seems that a lot of that had to do with the grinding. And I went to just a regular neighborhood dentist in Koreatown, God, probably 20 years ago. And they said, you grind and you need to wear this night guard. And it was like $750 for the night guard. And stupidly at the time, I thought they were just trying to like give me another line item on the bill and, milk me for $750. So I was like, I don't need that. Went on for years grinding and having no idea, because you're sleeping. Like I didn't wake up going, oh my God, I'm grinding. But the degradation of my tooth height showed that. So Kyle Kingsbury led me to you, a patient of yours and a friend of mine, and he had a similar kind of problem. So my question...
It was either that for him or getting punched in the face a few hundred times. But, so it was very similar. Yeah.
So the interesting thing about it for me is, if I hadn't found you and I would have just went to, I guess, like a cosmetic dentist that could have just capped all my old, damaged teeth, they would have just built that bite on a misaligned bite based on my old bite that was wrong, right?
Right.
So I feel like I dodged a bullet in that it was just the time had come where I needed new permanent teeth because mine were just not usable.
Yeah.
How many people do you think go and get, a whole mouth restoration with dentists that are ignorant of airways and the neuromuscular aspect of it?
No, that's very, very true. The challenge that we have in this neuromuscular field is one of just exposing this to more dentists. And one of the things that I've been involved with throughout my career is there's a teaching facility in Las Vegas where for 25 plus years now, I've been a clinical instructor there of courses that teach dentists how to do this stuff. Okay, and in that time, we've served over 10,000 dentists from 52 different countries across the world, teaching them about this type of dentistry. It's gotten to the point now where I'm actually kind of changed from clinical instructor to myself and a couple other guys are actually in charge of doing all the courses. And the challenge that we have with this is getting people into the courses, getting dentists into the courses. Been around for a long time. The track record is certainly there. The success is there. But many times, dentists in this area don't want to step outside the box of what they've learned. It's they learned this. They're comfortable with this. This is what their buddy knows. This is what their dad, who was a dentist, knew. This is it. And if I have to go learn all this other stuff, it's going to take time. It's going to take money. It's going to take effort. And so sometimes dentists have the opinion that, being okay is good enough. They don't want to go to the next level. They don't want to continue the learning process to be able to expand their knowledge so they can help this huge group of people that have issues that need help that just are either ignored or kind of poo-pooed along the way. Is like, take this pill, you'll be okay. And, it's honestly kind of more of a traditional medical approach to things. Instead of finding the source of what the problem is, take this medicine. There's a group in dentistry that says clenching, grinding, TMJ pain and issues, it's all psychological. Just it's in your head. It's really not happening. You should meditate. You should do whatever. And
if that worked, I would have been fixed a long time ago. I've been meditating for a long time.
Yeah, I mean, a lot of people would. But when you think about that stuff, it doesn't make sense for that to be that way. So, the unfortunately, there and patients don't know. Many choose their providers based on their friends have had a great experience, or they're somewhere they personally like the office, the doctor. He's nice. It didn't hurt me, but the decisions are made more based on things like that rather than knowledge of procedures and things that could truly help them, instead of just kind of masking over the fact. You talk about having your situation done with a cosmetic dentist or whatever. I'm sure they could have made your teeth very nice and pretty and all that kind of stuff. But my question is 3, 4, 5, 10 years from now, how many of them are still going to be in there that haven't chipped and cracked and broken? Because if you're doing that to your own teeth, you're absolutely going to do it to porcelain teeth, because they don't wear, they break. So yeah, initially it can look nice, but the question then becomes, how long is it going to last? And you didn't have a lot of pain type of symptoms, but most people in situations like yours do. And so in that same scenario, you could go and have a pretty smile. It looks nice, but you still have all these other issues, from headaches, ear issues, facial pain, neck issues. I mean, it's very far reaching. So pretty smile versus I still feel like crap. I mean, now in doing it the way that you've experienced in this kind of this more total body approach to things, then you can have the great smile, know that it's going to last, and not have pain all at the same time.
As you're describing that, I don't think I noticed it until right now, but I don't have neck pain anymore.
We deal with so much.
It's so weird.
Which is crazy.
I didn't realize it's kind of one of those things, like you have something that just becomes chronic and nagging, and then you sort of just numb it out. And I realize right now it's taken me some time to actually identify that it's much better, even though I worked with Alex Rybczynski, who I'm sure was helpful in getting everything aligned structurally so that my new bite fit. So that was great working with him. Shout out to Alex. But thinking back, even kind of throughout the procedure, as we were putting in the temporary orthotics and all that, which we can talk about, I was still having some neck problems, just waking up and just feeling weird. Yeah. And I'm happy to report that that's gone.
Yeah.
It's just really
and what's crazy with people is early in the process, we'll ask them questions about their neck. Or here's one that makes no sense to most people. One of our initial questions can be about, do you ever experience numbness or tingling in your hands and fingers? Okay, now I'm a dentist. I'm asking you about numbness in your hands and fingers. How does that fit? There's teeth and there's fingers. I mean, what's the connection there? But it has to do with muscles that extend through your neck, that wrap around certain nerve centers, that then go down your arm. And next thing you know, you've got numbness and tingling in your hands and fingers. So what we're dealing with is not just teeth, and it's not just your jaw. it's all the things that are interrelated and connected, and how do these things function with each other instead of against each other. It's the old hip bone connected to the knee bone and all this kind of stuff. We spend so much time with people on their posture, both head posture, so neck and cervical posture, but back and hips, and again, what does that have to do with dentistry and TMJ and jaws? But it's all connected. And to get the most optimal result, we can't ignore those things. You may get better, but not as good as what you could have been if we didn't address these other things.
Sure. And what do you think are the most common root causes of the grinding and clenching that wears people's teeth down, and then I'm sure has other effects? We can get into headaches and TMJ and TMD and all this. So what's the deal? Is the person, aka me, trying to get more air at night and then trying to create space, or what's happening? If it's not a psychosomatic thing of, I'm really stressed out, I need to meditate, which I don't think was the case with me, because of times of low stress and everything going well in life, I still was grinding just as much as I would have, in a stressful time.
And that's such a common thing that people will tell us is like, I was clenching some, but I'm just stressed, and the stress goes away, I'm not going to do it. Well, you are going to do it. You may not be as aware of it, but that doesn't change based upon only stress. Can stress be a role in things? Sure, but it's not the cause of things. So how does all this happen? Man, that opens up a big continuum box here. So it goes back to when we're babies. I mean, literally out of the womb, initially, the ability to suckle properly and breastfeed. So are there things called lip ties and tongue ties, which is a connection of the tongue or the lips through muscle fibers that don't allow the movement that they need to suckle properly. And it's very easy to see, but yet the person who typically catches it, if it's caught, is a lactation consultant, 3 months into it, when mom is dead tired and sore because it's not happening right, and the baby's frustrated and has gas, and it's just this whole breastfeeding thing just isn't working. But if you know what to look for, and again, it's not hard, it's just having the medical community relate 1 + 1 is 2. If you know what to look for, then the treatment is also very easy. I have 2 grandchildren. Both of them had lip and tongue ties when they were born, and both of them had them released within the first 5 days of their life. Special laser, pediatric dentist that handles that kind of stuff typically. And it changed the course of their development. So let's say that didn't happen, and which it doesn't so many times. So that leads then to typically breastfeeding not happening as long as it should. Okay, so then you transfer to formula, different things. Well, obviously one of the benefits of breastfeeding is the autoimmune effects that it has in helping the child to have a more optimal nutrition that helps them develop ways to combat things that they're going to be up against as they get older. So when that doesn't happen, then all of a sudden you've got problems with allergies and ear issues and things like that can all go back to the simple fact that they didn't breastfeed long enough and have those inherent benefits from that. So then that goes on. They've got earaches, they've got allergies. They're typically, with the inflammation that can create from allergies, then they turn into mouth breathers. And there's so many pictures of little babies, and you'll notice their lips, and they're asleep, and their lips are not closed. And the baby looks so cute, and they do. It's a cute little baby. But what they should be doing, if things were working functionally properly, is the lips should be together and they're breathing through their nose. If they're not breathing through through their nose, they're breathing through their mouth, and that changes the tongue position. The tongue is a very strong muscle, and it's kind of the developer of facial form, especially the upper jaw. So if the tongue is resting low, it's not in the roof of the mouth where it should be because they're breathing through their nose. So they're breathing through their mouth. The tongue is low. The tongue is not where it should be to help the body form the right dimension of the upper jaw. Then that continued mouth breathing goes on over the next multiple years, and which many times then leads into, well, we talked about earaches, the chronic ear infections and stuff, which has to do with eustachian tube coming from the back of the throat into the ears, and how that all happens. Children grinding their teeth, and many times people talk about, I can hear my kid sleeping in there and their teeth are grinding. You see flattened baby teeth. That's simply a response of, I'm trying to breathe. I need to get my jaw forward. Let's do something to keep me breathing. So that is a sign as well. It continues on from there. Now we've got tonsils and adenoids that are huge and inflamed and left in there many times too long. Because again, we go back to the medical community on this, the reimbursement rates for tonsillectomy is like next to nothing. So whether it's the right thing to do or not, many physicians don't do it just because it's not worth their time to do it, which opens up the door of healthcare and insurance and all this kind of stuff. I mean, like I was saying, this can go so many different ways. But so then tonsils adenoids are kept in place, which makes nasal breathing that much harder. As they get older then, and especially as adults, one of the things you'll remember in your case, we take a special 3D CT scan of your head and neck. And with that, we're able to see inside your nose things that are called turbinates, the nasal septum. And so many people that have difficulty breathing through their mouth, it's related to the inability to breathe through their nose because the turbinates are enlarged, which cuts down on the airway volume, and you just can't get enough air through your nose. So again, one way or another, you're going to breathe, so you open your mouth and you breathe through your mouth. Nasal breathing is completely different than breathing through your mouth. You'll get oxygen both ways, but in nasal breathing, you also get the benefits of the production of what's called nitric oxide, which has huge overall body benefits. So this natural production doesn't happen as well. There's also things that go back and relate hormonally that can affect appetite. And many times, one of the reasons related to obesity or being overweight has to do with the inability to breathe through your nose and the lack of this hormone reception. You just keep eating. And so there's so many levels to this that all start back when you were a kid and are centered around breathing or the inability to breathe, and then the formation of the face that is a result of those changes that didn't happen. So in a person that is mouth breathing for years and their facial form doesn't happen, and I just thought of this too that I want to bring up. I think one of the most misdiagnosed problems we have with our children as they grow up is related to the diagnosis of ADHD. Because the symptoms of not sleeping and the symptoms of ADHD are almost identical. And so the idea that all of a sudden every kid you run into has diagnosis of ADHD, and I can look at them and see the physical changes and tell you, absolutely, that's more than likely not the case. The kid can't breathe at night. And there's so many actually very moving stories, almost like little documentary stories I've seen on YouTube of families that have documented the problems that their children have with this exact issue. So the kid isn't sleeping, they go to school, they fall asleep, they cause problems, they're not learning, They're not able to concentrate. They're creating problems and troublemakers. And, one thing leads to another, then that gets them kind of typecast into this kind of kid. So that further kind of takes them out of maybe the better educational opportunities over here, because that kid it's got ADD, put them over here. And many times they just get forgotten about or lost in the shuffle. And the simple realization that the kid's not breathing and do things to change that, whether it be tonsils and adenoids removed, changes within the structure of their mouth to orthodontically, typically at that age, to create more room for their tongue, to look at things that are going on inside their nose, to control allergies, to just enable the kid to freaking breathe. And then as soon as that's done, it's like it's a completely different kid. Didn't have ADHD. She couldn't breathe.
Wow.
And so another issue that we have in dentistry is getting people to understand this, because it's not taught. This is all stuff that you have to go out after you're out in the working world and educate yourself about, because it's not part of our formal teaching. But this stuff, whether it be airway, whether it be the neuromuscular TMJ kind of stuff, that has such a huge impact on people's lives, as opposed to doing a filling on their molar. I mean, needs to be done, but no, I can't think of the last time someone thanked me for changing their life by doing a filling. But I can tell you multiple stories of patients that we've had that were on the verge of suicide due to pain and a feeling of there's no one else that can help me, until they came into our office. We were able to address the issues, get them out of pain, and change their life that way. I mean, so for me personally, that's why I do this stuff. That's the impact that I want to have on people, to truly have an effect on their life, rather than cleaning their teeth. So
Nice. That's a great overview.
yeah.
In terms of the mouth breathing in kids, and then the subsequent grinding and behavioral issues and all the things that come after that, what happens to the formation of a baby's jaw and teeth and mouth when they're breastfed for a natural duration of time?
Sure.
Versus in my case, I was never breastfed once.
Yeah.
I guess
that explains it then.
I guess I was eating out of a bottle. Yeah, if ADD would have been a thing when I was a kid, which I don't know, I don't think it was. They just said, this kid's nuts. Put him in the short bus.
Yeah.
But if a kid's eating or getting their sustenance from a bottle, the nipple on a bottle is much different than the nipple on a breast. And most parents, I think, still give their kids pacifiers because they want to suck on something. What do bottles and pacifiers do to make this problem worse versus a kid who's breastfeeding for 3 or 4 years or whatever?
Obviously, great question. And I will say this: there is, if you have to do that, if you have to bottle feed, if you have to, or you think you have to use a pacifier, which you don't, but if you think you need to, there is a company called Nook. It's NUK, that has a very, very unique shape to their pacifiers, to their bottle nipples, that if you have to do it, that would be the one to do. But that aside, there's no comparison to the benefits that the natural breastfeeding would have. So the changes, again, have to do with tongue position and what the tongue does during that process. It's a very different positioning. I guess the suctionability or whatever of one versus the other is very different, which begins the process of forming this very moldable, bendable, bony structure that we have as a child, and starts the process either the right way or the wrong way. I've got a friend right now that has a grandson who's oh gosh, I think he's probably almost 3. Every picture I see of him, he's got a pacifier in his mouth. Like, dude, rip that thing out. What are you doing? And you get to the point where a kid's 5 or 6 or 4, in that range there. I can tell just by looking at a kid if they've been on pacifier for the majority of their life or not, because it changes the bony structure of their face. And therefore the lip position changes, the teeth position change. And it's very identifiable if you know what you're looking for. But the parent many times thinks that, well, it's soothing for my baby. It's going to help them sleep better. It's going to do whatever. You may think that, but you're thinking incorrectly. There's other ways to do that without damaging the facial growth, the airway breathability of your child by giving them this pacifier. So I'm really big against that. There's no need for it. It's a convenience for the parent more than anything. And
I mean, it's going to keep dentists like you in business if they keep doing it.
Yeah,
Eventually they're going to hit their 30s, 40s, or 50s and come see a guy like you as an adult because their bite is jacked up,
It's crazy. I remember when I first started in practice, I was in a small town in Oklahoma, and we had an orthodontist that would come in a couple of days a week and see patients in there. And the other dentists in the town, we all thought this guy was crazy. He was this wacko orthodontist because he would talk to his patients about their airway and getting their tonsils out and their adenoids out and doing all this airway stuff. And it's like, man, just go straighten their teeth. You don't need to talk about all this other stuff. Well, little did I know at the time, this guy was so far ahead of everyone else. We thought he was crazy. He was leading the whole area of this airway focused dentistry. And I would say this too. One thing that parents should definitely be looking for in orthodontists as they begin treatment with their kids for that is making sure that the orthodontist is talking to you as well about airway. Because again, most don't, and there are some that do, and I guarantee you this, the ones that do will have better, more stable outcomes than the ones that don't. So just a little
So
FYI.
say a kid has, teeth that aren't coming in straight, or there's big gaps and things like that, and they go to an orthodontist and they want to make their teeth, quote, straight. It's probably quite common then that they're making their teeth straight on a misaligned bite
100%.
that they're now going to have for life and have all these other problems, related to that later on.
And see, as someone like myself who deals with these problems after the fact, it feels almost like it's easy for the orthodontist to get nice straight teeth because he doesn't have to see the result of that 20, 30, 40 years down the road. So, it's a success. We've got straight teeth. Little Johnny's smile looks great. And then I deal with little Johnny when he's a big Johnny and has situations like you had.
Yeah. Yeah.
So from that standpoint, I think two important things there. Airway, there needs to be an airway consideration in orthodontics, and a couple more things. Kind of looking at things in an initial phase of orthodontics, anywhere from 6 to 7 to 8, probably no later than 9 years old, to do certain things that then sets the stage for maybe a second round in the 12, 13, 14 range. That's kind of a fine tuning of things. In that mix, unfortunately, still many orthodontists want permanent teeth removed to do this. And I can tell you the majority of those people end up seeing me because when that happens, it's easier for the orthodontist to get the teeth aligned, but in doing so, it also retracts the jaw and the teeth back instead of extending it more forward, where the ability to breathe is that much better. The more stability of their bite is going to be forward, not jammed back. So, and that's what happens when permanent teeth are removed and everything is retracted instead of the focus being more on forward growth.
Got it.
So just
that's interesting. I mean, I love this stuff. You can go as deep as you want on any of these answers, by the way, because I know myself and the audience are going to appreciate the nuanced perspective and the details.
Yeah.
One thing that I've always been curious about is the common practice of removing wisdom teeth. And I think you probably know better than me because you've seen it in my mouth so much. Which, by the way, I don't know how dentists do your job. It's so mouths are so gross to me. Whenever I get my teeth worked on, I feel guilty that the dental assistant and the dentist have to be inside my gross mouth.
And for me, it's like I don't even think twice about it. But I'd never be a proctologist.
Well, if you're going to be on one end, you pick the right end.
I'd rather be where I'm at, not at the other end.
100%. But to the point of the teeth, so I had the one wisdom tooth removed, and it seems to me, and I did an episode the other day on circumcision, for example. So I'm not a supporter of that practice, having been a victim of it. But I think that God is a really intelligent designer, the ultimate designer, and so I just think of body parts, whether it's the appendix or our wisdom teeth, that they're there for a reason. So is there a correlation between more babies being bottle fed and being on pacifiers and things like that, where the jaw and the space for the tongue and all of that shrinks up and therefore necessitates the removal of the wisdom teeth? Like, how did that come into practice? And is there ever a good reason for that? Or could you take a kid, like in the practice that you have, your style of dentistry, and they're starting to run out of room in their mouth? Could you apply some sort of device or something that creates more space to allow room for the wisdom teeth?
Very good points there. So the answer to that is, if you get that kid at 6, 7, 8, along in there and begin a process of growing that face the way that it needs to be, then you have a better chance of having room for wisdom teeth than if you don't. But why do so many people not have room? Because you cannot have room for your wisdom teeth and have a very stable bite. You have no TMJ issues. You breathe through your nose. That can still be. Well, it's interesting if you look back at very old skulls. I'm talking way back. Okay. What you'll see most of the time is they have their wisdom teeth erupted on the skulls. And at the time, the theory is a lot of that had to do with what the diet was. So back then, you're eating harder, crunchier things, your nuts, and you're using this device to for your nutrition, but your nutrition consists of things that are very, you have to chew, okay? So you're utilizing all this stuff. And over time, as our diet has changed and become more westernized, or whatever you want to call it, there's so much less of that. So the stimulation for the bone to be more robust is not there. And then over time, as genetically things are kind of passed from one generation to the next, our jaws have actually gotten smaller as a whole. So the main reason now is for the problem with wisdom teeth really goes back thousands of years ago to the change of our diet over time. You look now, even we've been talking a lot about kids. Everything's in a squeezable plastic tube. You got your applesauce, you got your Go-Gurt, everything's in this tube. And so you're not chewing anymore. You're not eating raw carrots and nuts and stuff like that. You're eating processed food. And I'm not saying that Go-Gurt has caused us not to have problems with wisdom teeth, but it's an example of how the diet has changed. And that change over these thousands of years is what led to smaller jaws and then the inability for us to have room for wisdom teeth. Now, if there's room for them to come in, there's no reason to take them out. But most of us just don't have the room for them to erupt into the mouth and be functional and cleansable. And when they're not, then they're either stuck back in the bone that can create other problems with the tooth in front of it there can be localized infections and things. And so it's better to remove them just to prevent these other problems.
Got it. There's an interesting thing that I came across recently. You see just these memes and short videos on social media and whatnot about the meridian system and how each tooth is connected to a different organ and a part of your body and all that. And so now people are starting to talk about the origins of the term wisdom tooth as it pertains to brain function and things like that.
Yeah.
And as you know, I've been dealing with tinnitus mostly in my left ear for a long time.
Right.
And I wonder if there's a correlation between having my upper left wisdom tooth removed, if that affected something in the inner ear at some point. I think I had it pulled as a kid. So it seems to me like, again, going back to just intelligent design, that had we not been on grains and soft foods for the 10,000 years or whatever, and everyone's heads and skulls have shrunk and we're kind of devolving, right? I wonder if there's a more like a involved purpose of the wisdom teeth, that and having them removed perhaps creates other problems.
And quite honestly, I am probably not as up on the whole meridian aspect. I know of it, but I don't know enough to really speak about it that much. But as you pointed out before, I don't think God made anything that we weren't supposed to have, right? So whether it be your appendix or whether it be a wisdom tooth or whatever, I think they're there for a reason. And it's kind of foolish to think that, we have these expendable parts because they're just there and there's really no use for them. So I don't know. I think that's more a man-made problem than one of the design of our body.
Totally. I mean, think about like the conservation of energy. Why would our bodies be designed to pump all this energy into making wisdom teeth if they weren't useful in some way?
Yeah, that's exactly right.
But anyway, here we are.
Yeah.
What was I going to ask you? Oh, I want to go back to just kids because I know a lot of parents listen to this, and I want to help people avoid having problems later in life, like the ones that I'm always running around trying to fix. So you mentioned this superior bottle. What was it called? The Nook?
Nook, N-U-K.
Okay. N-U-K. We're going to put that in the show notes, by the way, you guys. We'll call it lukestorey.com/winters after Dr. Kevin Winters, lukestorey.com/winters. So we'll put information discussed in that. Now, do those guys make a different shape bottle, or are they making also pacifiers?
No, they do both.
Okay.
There's different sizes of pacifiers with this same basic shape, different sizes for the bottle that fits anymore. Of course, I'm kind of past the point of using or being around those myself, but I know they used to have the top, the nipple part as separate from the bottle. They may make the whole thing together now, but I'm sure at this point there's multiple products available through their line. But like anything else, search it on Google and I'm sure you can get there pretty easy.
Great. And then the other thing I was going to ask about that was, what was it, Luke? What was it? The bottles, the pacifiers. The tongue tie or lip tie situation for people that have newborns. How would they find a proper practitioner to determine if that's an issue?
No, it's a great question because
fix it.
It's typically going to be a pediatric dentist. Some general dentists do it as well. There are some ENTs that may be involved with that also. The thing that's, I think, the most important part of that, other than their training and abilities from the individual, but it's the use of a special laser, a certain type of laser to do the procedure. It revolves any cutting and stitching and things like that, so you don't have to worry about that. It literally goes in and just kind of melts away the fibers that are connected, and it's the healing is quick, easy. There's not a lot to it. The response from my personal situation with my grandchildren, I didn't see really any, you'd think, pain or soreness or big recovery afterwards. They're just kind of back to normal after that. So hopefully the hospital itself would have someone there that could identify that. But in the preparation classes that so many moms will be a part of, them, or couples, whatever, that's a question to ask the leaders of that. There should be some type of network set up that could get quick answers for that. Now, if not, just off the top of my head, I think reaching out to a local pediatric dentist and just asking them, do you do this? And because if they don't, they probably know one that does. But that would be probably the primary resource to start with if you can't find information through the hospital-related people.
Okay, cool. Do you ever have cases with clients of yours where you recommend having a tongue tie or lip tie released as an adult as
all
part
the time.
of your? Oh, you do
all the time.
And I didn't have it bad enough.
No.
Okay.
No. That's again one thing we haven't talked about, but that's part of the kind of this overall approach I take with treating facial pain, TMJ issues, bite issues. The process should be the same. In fact, I use the same pediatric dentist for these adult patients. But number one, you've got to identify it. You've got to check for it. Again, nothing I was taught in dental school. This is all after the fact stuff. So after you identify it, then there's some things that we also work with a great lady here in town named Tracy Brizendine, who is a myofunctional therapist. Basically, she's a tongue lady. I mean, who even knew that was a thing, right? But she's probably the most enthusiastic tongue person you will ever meet. But what we use her for with our patients is to help people train their tongues to function properly. I don't know about you. I don't go around thinking about my tongue very much, but there are definitely things that it should be doing and things that it shouldn't be doing. And sometimes it does things the wrong way because it can't do it the right way because there is a tongue tie. It doesn't allow the mobility of the tongue to be there. So the myofunctional therapist, her role in this is to give you tools and exercises to train your tongue what it should be doing and not doing. And many times when the tongue is tied, then it's also weak at the same time. So she'll go through a process of kind of strengthening the tongue. And then once that's gone through its process, the referral to the pediatric dentist to do the tongue tie release is done. And the tongue is strong enough to control itself in the proper way once it's loose. Okay. So what does that have to do, again, with bite and TMJ and pain and all this kind of stuff? Well, tongue ties in particular, they're a muscle connection to your tongue. And there is a, kind of think of it like a spider web that goes through your body called fascia. Okay, so fascia kind of holds things together. And at the top of this fascia is this connection into your tongue. And there's a ENT in California, his last name is Zaghi, that has a on his website. He does a lot of tongue tie release and is very involved in this. But he's got a lot of information on his website and YouTube videos of patients undergoing tongue tie release. And here's what's crazy, but it relates back to this fascia, this connection of kind of everything being held together. So there's one in particular that I remember. A guy is in the chair, that they're filming him, they're asking him questions through the process. Yeah, everything fine, it doesn't hurt. And doctor's doing his thing. But as he's sitting there in the chair, his leg or his foot is kind of bent over to the side like this. And it's just normal. That's how his foot always sits. It just sits. When he sticks his leg out, it just kind of hangs over this way. When the tongue tie release is finished, he looks down and his foot's straight.
Oh, wow.
And so they start talking about that. It's like, what's going on? What do you mean your foot is straight now? He goes, I have no idea. It just straightened up as soon as you were done. Kind of crazy, a little weird when you think about it, but it relates back to this kind of this interchange of how everything's connected. Many times in these other videos, you'll have people undergoing the process again, and it's done, and their immediate response is like, "Oh man, it feels like my shoulders are loose now. I can open up my chest, and I feel just different and loose up top here," which again has to do with fascia being pulled. Now it's released, and it allows things to just kind of relax. So with that, as far as your jaw position goes and muscles up here, once it's released, it allows these muscles as well to kind of change position of the jaw and find a more comfortable or closer to a more comfortable position jaw-wise as well. But yeah, so I mean, and that's kind of how it works with adults in tongue ties.
Awesome.
Yeah.
Let's talk about the diagnostic process that you do, which for me, as someone who's just into crazy health stuff, was really interesting. I like being hooked up to electrodes. I know something cool is happening, but the stuff that we did in terms of diagnostics was very different than, and I've seen some great dentists, and of course, they might take a look for cavitations with, a certain scanner and things like that. So beyond just regular x-rays, but you were hooking me up to TENS machines and all kinds of stuff. So maybe, I didn't ask that many questions as we were doing it. I just kind of went with the flow, but maybe break down, a typical process for you in terms of diagnosing someone's bite.
Sure.
And then how you go about determining how you're going to fix it.
Yeah. Well, early in the process, we still take normal dental x-rays and stuff because we're looking for normal dental problems, as part of the process. So whether it be gum disease or bone loss or cavities, I mean, that's kind of all included. But more specifically to what our focus is here is we start with a 3D CAT scan of the head and neck. And so we're looking at cervical vertebrae alignment. We're looking at nasal passages. We're looking at sinuses. We're looking at jaw position within the joint. We actually check for carotid artery calcifications and or even others as well that can be indications that, hey, you need to get with your physician because this is a stroke ready to happen type of thing. So we're able to utilize it for multiple things. In addition, and this is rare, but it's part of the process, that there can be tumors and cysts and things that we can find through the use of that because it's such a encompassing view of the head and neck. But gives us a lot of early information. We combine that with an extensive history of issues, both kind of how the patient is feeling and what they've noticed over the years, in addition to what I'm visually seeing inside their mouth and visually looking at their posture, looking at their head position, looking at, is the shoulder down versus that, just all this alignment stuff that you have no idea I'm doing it, but it's part of what I'm doing. We take that and come up with kind of an early thought of what might be going on. Now, the next step in this, and we have some very unique technology that we're able to analyze muscle activity live. So it's a way of using what's called an EMG to get the activity of certain muscles that we put all those little pads on that you remember. We can also track movement of the jaw in 6 dimensions. So by use of a magnet that's placed and opening and closing and moving, we can track jaw movement and how that relates to what the muscles are doing. So we get not only that the jaw opened, but this muscle contracted to make it move, and it just gives us a complete picture of everything related jaw-wise. Once we have that, then I can put all the information together and kind of come up with a plan of attack. How are we going to do this? What does this person need? And in many cases, and this was the case for you, we started with what's called an orthotic. So an orthotic is used to help simulate this new jaw position, and it looks like the muscles want the jaw to be in, but the teeth keep telling it to go over here in the wrong position. So in order to find that position, we utilize a very special frequency of TENS unit to stimulate a couple of nerves that then innervate multiple muscles and tell those muscles to just kind of chill out. It gets them into their most or to their best physiologic state. It gets rid of lactic acid. It pumps in oxygen and just changes the chemistry inside the muscle to a point that the muscle is as optimally conditioned as it can be. When that happens, there's typically a movement of the jaw as well. So the jaw may decompress, it may open a little bit. It typically will come a little bit forward, which is why in so many people we see wear on teeth of the front teeth, the lower front teeth in particular, because it's easier to see than the back of the inside of the upper teeth. But lower front teeth with wear is there because the lower jaw is trying to come forward, but the upper teeth are in the way, and so they sit there and they rub on each other.
Oh, interesting.
Right? So the muscles are telling you, I'm trying to get forward, but I can't get there because these stupid teeth are in my way. So I'm going to get rid of these teeth. Okay? I'm just going to grind them away.
Oh, man.
Okay?
You're bringing back traumatic memories of my poor old teeth.
Yeah. So when that happens again, the jaw will open. It will typically come forward. It can, rotate in any kind of dimension here until it finds this place where, from a muscular standpoint, it's just kind of hanging out in space. So we're going to capture that position with some material that we squirt between the teeth and it hardens, and it enables us to capture the relationship of the top teeth to the bottom teeth. So
when all the musculature in the face and neck is relaxed.
Yes.
Yeah.
Right. So the teeth aren't touching at that point.
Yeah.
Now, how much they're not touching that's always different on every person based upon what their body is asking. One of the things with the traditional approach here is maybe with a night guard or whatever, it's like, I'm going to take some impressions of your teeth. I'm going to make this night guard, and then you just wear it. Well, how does the guy in the dental lab who's making the night guard know where to put your bite? I mean, obviously he doesn't. So it's kind of a one-size-fits-all. Put it in your mouth. The dentist says, all right, tap on this. Let me grind it. How's that feel? Okay, that's your answer. Well, sometimes it works, but many times it doesn't work. Many times it creates more of a problem than what was there originally because it's just doing something without any knowledge. Now, utilizing all this technology that we have, I have the knowledge. I know where the muscles want to be. I know where the bite needs to be. And so we test that out with this orthotic. So there's two different types of orthotics we use for different situations. One is fixed, which is it fits on your lower teeth. It is shaped like teeth. It looks like teeth. It just makes your lower teeth taller. So if you can imagine your jaw opening and now there's space in there, this orthotic fills the space in. So now you can close. It touches your upper teeth. The orthotic touches your upper teeth, but your jaw is down here where the muscles want it to be. So this is kind of our test drive for the bite. The technology has shown us that the muscles are comfortable here. It looks good based upon my knowledge of different things. Let's try that position and see how you do. We'll put the orthotic in. And there's another kind that's removable that is used for different situations, but the process behind it is the same. So you've got the orthotic in place and you just wear it. You chew, you talk. I mean, you remember this.
Yeah. I remember how difficult it was to adjust because I had an upper and lower orthotic, which is like what he's describing, you guys, subjectively. My experience of it was, a singular row of teeth on the bottom, a singular row on top, so not individual teeth. Kind of like a night guard, but it just looks like teeth.
Looks like teeth, right.
And man, I remember coming home and trying to talk and eat and chew. It was so weird.
Yeah, and I'll tell you, in your case, doing the upper and lower orthotic, we do that maybe one time out of 20.
Really?
Yeah, it's usually just the lower. But in your situation, it required both.
What if I would have come to you and said, hey, my teeth are jagged and yellow and I can't chew very well. And, I'm going to end up getting more cavities and having to drill and fill more of my teeth.
Yeah.
What if I would have come in and said, I just want my teeth to look pretty. I don't care where my bite is. I just want to leave my crappy bite and jaw position where it is, but I just want it to look better. Would you even do that?
Yeah. So here's how we handle that, because we get that situation from time to time. Look, I will do it for you as long as you are informed of what you're asking for. Okay. Here's what's going to happen. I don't know when, but here's what will happen. There's a chance that the porcelain will break. There's a chance that you'll have to redo some things at some time. I'm going to give you an orthotic type of nighttime appliance that I'm going to ask that you wear. Now, whether they do or not, it's up to them. But here is the best thing I can do for you to make sure that this lasts as long as it can. Knowing that it's not the right way to do it. If you choose for me to do this, and you understand all these things, I can do it for you, but it's a compromise. There are limitations. Here's what you should expect. And if you're okay with that, I'm still going to do a great job of doing the case, but there are things that are then out of my control. Right?
Got it. Okay. And so in my case, my natural tooth matter was just, it's beyond repair. There just wasn't enough of it there to do anything with.
Right.
So
which is why we had to do top and bottom.
Okay, got it. So, so I, for me, it was a no-brainer. I want my jaw properly aligned and to alleviate neck and back issues and all of those things. And so I had to get all crowns and veneers anyway, whether or not we fix the bite or not. What happens when a client comes to you and their original teeth are in good shape? They're not all jagged and chipped up and grinded down and all that. Is there a way to do what you did with me to move their bite into its proper position without doing all the crowns and veneers?
No, very good. So here's kind of the typical options for handling bite issues. Okay. One, you can just do a removable orthotic and just wear plastic from now on. Some people can wear it just at night. Some people can wear it a few hours a day and night. Some people can only be comfortable if it's in their mouth, so they wear it 24/7. Now, usually that's a financial decision that they just can only do this. And although they might want to do more, this is all that they can afford to do at the time. So it doesn't mean that other things can't be done later, but right now this is all I can do. Okay, so there's that angle. Sometimes the bite change is enough that we can just do what we call an onlay on back teeth. So maybe you just do maybe 4 back teeth or 8 back teeth. And again, you think about it this way: as the bite opens, you've created space. You just need to fill that space in. So you're not having to cut the tooth down to do like a crown or something like that. You're just kind of building it up. It's onlaying the tooth, right? So sometimes you can just do onlays. Sometimes you can do a single arch, whether it be the top teeth or the bottom teeth. And then sometimes you have to do all the teeth. So there's all these different combinations. Then also, there's a way of doing orthodontics at times to move teeth into that position. I've done that with patients in the past. I'm currently not doing more of those cases for different reasons, but there are some dentists around that can utilize this bite change information and then move the teeth into that position.
Using like braces.
Using braces,
okay.
and to get away from doing a bunch of onlays or veneers or whatever on teeth. The typical scenario there is the 22-year-old girl that's never had a cavity in her life. I don't really feel that great about putting crowns and veneers on all her teeth.
Right. Right.
Sometimes you have to because there's no other choice. And again, it's done in a way that's going to last for many, many years and as good as it can be done. But if I had my options, I'd rather not. Sometimes you don't have that option. But so that's a great candidate to do things maybe orthodontically. Great teeth, just jaw pain.
Got it.
And how can we improve things by still using the orthotic to test this new bite position. And if that alleviates symptoms, then we know we're on the right path. Now we just got to make the teeth come together.
Got it. Okay.
So,
Yeah. So if it's possible to salvage perfectly healthy teeth, that's one option.
always the goal.
Because in order to put on the crowns and veneers, I mean, you have, depending on how much tooth matter is left there, but you have to grind down the original tooth to varying degrees in order to make room for the porcelain, right?
Well, but the word you said there, varying degrees, is very true, because sometimes I can shape a tooth in a way, because remember, again, we've got extra room. We've got space between the teeth. So we're augmenting these teeth. Sometimes I can just create a little, what I call a margin, a little edge along the tooth to give a place for the porcelain to sit against. And that's all I have to do on the tooth itself. So there's very, very little tooth removal because we're building things up. Now, that same patient in a bite that's already closed together, the teeth are touching, there's no room to augment it, then I have to take tooth structure away to create room for the porcelain to fit inside that bite.
Sure. Okay.
But so many times what we're doing, there's excess room. So the preparation of the teeth themselves can be very conservative and get the job done. So there's no reason to grind down just to build back up.
Right.
Right.
And
I've already got too much room. I just want to
Right.
augment it.
And in a case like mine, since my teeth were ground down to nubs, you probably didn't have to remove that much of the original
Yeah, I mean, a lot of
tooth
the work
matter.
was already done for me.
I've been doing it, sleeping every night, grinding my teeth for 50 years.
You started years ago for me.
Yeah.
Yeah.
All right. That's interesting. Let's go into TMJ. Is this, I get questions about this all the time. And I know it's just such a prevalent issue for people. But not only TMJ, but the difference between that and TMD.
Yeah. Well, TMJ probably is the more commonly known phrase. TMJ, temporal mandibular joint. People say, "Oh, I've got TMJ." Well, actually, you have two TMJs, one on the right, one on the left. It's just a catch-all phrase that people have become used to hearing. TMD, temporal mandibular dysfunction, is actually the more accurate name for this situation.
Oh, okay.
So the dysfunction is what we're talking about. We're not talking necessarily about, again, the joint itself, because everybody has two TMJs, right? We're talking about the dysfunction of those joints. And what all that can encompass is a big list. But let's go through maybe some of the more common things related to the dysfunction of the joints, so TMD. An extremely common one that's so not connected is headaches. I mean, simple headaches, migraine headaches, all kinds of headaches. And the majority of any headache is a muscle-related response. Now, there are things that are related to arterial issues and things that create a specific subset of headaches. But most headaches are muscle-related in one way or another. What's the goal of neuromuscular dentistry? Is to relax muscles. So with an extremely common symptom being headaches, what we're trying to do there is, because the majority of headaches have some type of muscle component to it, is exactly what we do in neuromuscular dentistry. That is, relax muscles. Once muscles are relaxed, then these type of symptoms, whether it be headache or others that we'll talk about here in a minute, begin to improve. Many times can go away. So we can literally take people that are dealing with daily headaches, chronic weekly migraine type headaches, combination of all those, and to the point that it has affected their life for months and years, and it's just become who they are, is another headache. And we can make them go away simply by changing jaw position and allowing these muscles to relax. So headaches is a very common one. Now, the obvious thing of clicking, popping, joint-related pain and discomfort, facial pain, Very obviously, that's related to a TMD type of thing. One thing that's not so connectable or noticeable, and you talked about this earlier, are neck-related issues. So tension, tightness, lack of mobility, all these types of things are related to, and most people say, yeah, I carry all my stress in my neck. No, you don't. There's reasons why those muscles are tense or tight. But we're taught that it's a stress response. It has nothing to do with that. It's a result, or I guess a result of things that are causing those muscles to be the way that they are. So think of it this way as far as head position goes, which directly affects neck health, I guess, is if you're hanging on to a bowling ball. Okay, so a bowling ball says 12 pounds. You got it in your hand, you're holding it up against your body, up close and tight here, and you can hold the bowling ball okay. It's not a big deal. All right, so let's take that same bowling ball and extend your hand out about 6 inches. That 12-pound bowling ball just doubled in its actual weight, or the feeling of what it is. And let's take it out 6 more inches. Bowling ball just got heavier again. It's an exponential change the further it gets away from the center of your body. So now let's do the same thing with your head. My head's forward. What has to happen to keep my head from just falling down? Well, these muscles in the back of my neck and my traps have to contract to keep my head upright. But let's let it go even further. Now they've got to contract more. So whether you know it or not, these muscles are working 24/7 just to keep your head upright so you can breathe. So like any muscle, I mean, if I go to the gym and I'm working out and I'm doing bicep curls, it gets to a point where I can't do any more bicep curls because the muscle's just tired. Well, these kind of muscles don't have the chance to just decide to turn off and not work. Your jaw continues to move. Your head continues to move. It has to be upright. So because they're forced to continue to work all the time and they don't really get a chance to rest and recover, then that's when they reach this beyond threshold of their capabilities of doing work properly. And so then symptoms come in.
Got it.
Tension, tightness, stiffness of my neck many times has to do with cervical, neck posture, head posture.
Which is probably even compounded by our addiction to devices, right? Always like text neck, looking down at your cell phone all day long.
Look,
you see people many people have these big lumps on the back of their, what is that?
My business isn't going away.
Is it the cervical spine, the
right.
top bit? Yeah, it's like
my business is not going away thanks to cell phones.
You've seen this has been made worse, huh?
100%.
Yeah.
100%. And now, so let's add another 10 years, another 20 years to the graduating high school senior that's addicted to their phone and goes through life still addicted to their phone and their head is always down. I guarantee you they're going to be seeing me.
Wow. Yeah, I've not very successfully tried to habituate myself. I'm looking at my phone to hold it up here. Then my arm gets tired,
Yeah.
It's like, oh God, put it back down.
It's hard, but
yeah, when you walk around, a crowded city, Austin, New York City, wherever, and you just see people walking around
all the time
with their head hanging over their phone, I'm
all
like, oh man,
because you see a group of teenagers that are all together. They're supposed to be hanging out, talking with each other, whatever. No one's saying a word. They're just all down their phones.
Yeah,
they're together, but they're like texting the person who's standing right next to them.
Yeah,
just through their phone. So yeah, that head position thing is and is going to be huge as far as health goes down the road.
100%. One thing that was compelling when I realized that I needed a whole mouth restoration, which is what you call it, right? What we did.
Yep.
So I was just trying to, think of any dentist I ever saw or friends of mine that had back in California, cosmetic dentistry done. And so I was reaching out, just trying to figure out who I was going to go see. And then when I reached out to Kyle, he said, oh man, Dr. Winters is amazing. He fixed me up. And one thing Kyle said to me, he said, for the first time in my life, I can sleep on my back without waking up snoring or choking, basically. And so I've never been told by anyone I've ever slept with that I'm a snorer, but I was grinding,
Yeah.
for God knows how long. So how are these issues fundamentally related to snoring
I love it.
and sleep apnea? And maybe you could even define sleep apnea, because I don't even know exactly what that is.
Sure.
It's just a term I've heard.
Yeah, let's talk about that, because it's so common. So basically, people know about two things. They've heard of snoring. They've heard of sleep apnea. They may not know exactly what it is, and we're going to talk about that. But there's all kinds of different diagnoses of what we call a sleep breathing disorder that are in between snoring and sleep apnea. Multitudes of different levels of sleep breathing disorders, I should say. So, it used to be, the thought was, grandpa's over on the couch and he's snoring, and isn't that just funny? And ha ha ha, no big deal. He's just snoring. But in actuality, snoring is a symptom of not getting enough oxygen. And if you watch a lot of snorers, what actually happens is when you finally hear that snore, many times it's preceded by kind of this almost a gasp. And if you watch them, you can see through their chest, or even movements in their head and neck. They're trying to get a breath. It's not happening. And then all of a sudden it's there's a snore, there's a gasp maybe, and their airway opens. Because again, brain's only going to take so much until it does something to make you breathe. So the level that's happening, and the actual degree of it is measured by what's called a home sleep, or not necessarily home, but usually now, because they've become so sensitive, is a home sleep test. There are sleep tests available that you might go into a more formal setting and into a sleep lab. And actually those tests are, probably still the gold standard, but it's difficult for people to arrange their life to go into the hospital and go in the sleep room. And you're in a strange environment. You're hooked up to tons of wires and leads and stuff. You've got people watching you sleep in this environment that you're uncomfortable in anyway. And so do you really get a true reading of what's going on? Or, obviously something's not going to be exactly how it is when you sleep in your own bed. So there are devices now that you can actually do this at home and maybe not get quite as detailed of information, but still enough to get a lot of information that has to do with, just how your breathing pattern is throughout the night. And then once we know that, we know kind of what to expect of what effects that can have on you from a body standpoint. Now, again, kind of the cream of the crop, best help that people can have with sleep apnea, which is the more involved version of a sleep breathing disorder, where there's significant non-breathing times throughout the night, would be the use of what's called a CPAP. Okay, so a CPAP is basically, it's a tube, whether it goes through your nose or your mouth, of forced air that makes you breathe. So it's kind of like a hurricane blowing in your face while you're breathing. And the thing with CPAPs are they work. They work. There's no question about it. The other reality about CPAPs is that everyone hates them and they don't use them.
Because are they noisy?
They can be noisy. They can just be obnoxious because you're tied to this tube and you can't really move, or if you do, then it goes over the side of your face. And they're difficult to use.
I'm trying to picture one, and it sounds like it'd be noisy and uncomfortable.
Yes.
Okay. Hence why people, even that need them, don't typically
and even
use them enough.
Even many of the literature that supports the use of CPAPs says that a successful night of using a CPAP is based on 4 hours. So my question is, what are you doing the other 2 or 3 or 4 hours of the rest of the night? If they're saying that the CPAP is great and it works and it's successful, but you're only using it 4 nights, or 4 hours during the night, that's half your night. That's half your sleep. So while it works, the problem is how people use it or don't use it. And so if you can get past that, you can't beat the results of it. But it's just every now and then you'll find that unicorn somewhere that they love it, they use it every night, but for every one of those, I've got 20 more that hate it and don't use it. One thing now related kind of back to what we do with so much of our focus being on airway and this kind of stuff is that we offer devices to help breathe better at night while you sleep. And it utilizes the same principles of relaxed muscles and an opening airway. And then with a special appliance that you wear in your mouth, it allows your jaw, your lower jaw, which is then connected, the front part of your throat, all the soft tissue, the muscles, your tongue is all connected to the lower jaw. So if we can keep the lower jaw from falling back as you lay down, gravity takes over, muscles relax, everything kind of collapses. If we can keep that from happening, now we've kept the airway as full and open as it can be.
And is this the device that I got where there's an upper, it's kind of like wearing an upper and lower night guard at the same time?
That's right.
Okay.
That's right.
And so that's keeping the lower jaw out here.
And what you notice with that, you can open and close, but you can't go back.
Right.
Right?
Right.
Which is the whole goal of this, is to keep things forward, keeping airway open. So now there's also many studies released kind of comparing the effectiveness of this versus a CPAP. Okay. Now, again, in advanced sleep apnea issues, I have nothing bad at all to say about a CPAP. It's what you need to be doing. But if you're not going to do it, what's the next best thing? Well, it would be an appliance like what you have that keeps the airway as open as it can be. And much different than the CPAP, these are very usable. You get used to it after the first few nights. It's like you just put it in and you go to sleep and it's not that big a deal. And you don't have a choice of whether it works or not because it just works.
Yeah, it kind of, it has a little sort of a locking mechanism, right?
Little fins on the side.
That keep it, which I think when I first started wearing it, I thought it was just so I wouldn't wear down my veneers from grinding, and I was like, this is different than a regular night guard. There's something else happening here. Yeah. And I think on our last visit, I asked you about it and you kind of explained this part of it briefly.
Yeah, and so in your situation, it kind of serves multiple purposes, primarily keeping the airway open, but by having the material between the teeth, it also protects the teeth in case something's weird. You wake up or one night you decide you're going to grind your teeth again, which I'm just joking here, but really it offers protection as well. So you get that added benefit and the airway as well, all within one appliance.
Do you ever have situations wherein someone is either unwilling or unable to afford doing the extensive work that I've done and they just get the nighttime appliance to help with the airways?
Yeah, absolutely.
Okay.
Absolutely. Yeah, there's, the good thing in this is that there's different levels, there's different possibilities of what we can do. We don't have to, it's not an all or nothing type of thing, because, there are budgets people deal with. And if the ideal thing is outside the budget, then what's the next best thing? Well, we can do this. Here's the differences. Here's some compromises you may have, but it's going to be better than what you're doing right now.
Got it.
So yeah, there's different ways of figuring out what level you're going to play in this game.
Yeah. Well, one thing that I think is hopeful for people, because if you're doing the most extensive version of it, which I think is what I did, there's great financing. Like I put down some cash and then financed a bunch of it on, I think it was 0 interest, which is great because the way I looked at it, because it's a good chunk of change. But for me, I thought, okay, I can keep going. I can keep my old beat down teeth, keep grinding them, forget to wear my night guard much of the time, or just don't like it because it'll pinch my cheeks and then I take it out or something like that. But I kind of did a cost benefit analysis and thought, okay, if I hang on to these teeth and I just string them along as I can, I'm going to be spending a few $100 every time I go to the
Sure.
dentist to try to, like, put lipstick on a pig or kind of a Band-Aid solution. And so I just kind of thought, all right, well, if I have these teeth, they're going to last me probably the rest of my life, I think, unless, I could get in a fight or something, get them knocked out of my head. So I thought, well, I'd rather just spend all the money right now, fix not only my teeth, also my bite, and therefore, neck pain, sleep, snoring, all the kind of stuff that we've discussed,
Mm-hmm.
but also just the relief of not having to deal with my teeth anymore.
Sure. Yeah.
It's just like, oh my God, just all those. And even though I had to come to your office, I don't know how many damn times, felt like I should just put a cot in the back room and just stayed there. So a lot of visits. But I thought every time I went over there, I was like, oh man, I'm going back to Kevin's office again. I thought, well, I'm going to take so many fewer trips to the dentist later on and keep drilling and filling my teeth until they're just gone, So that was a big consideration for me, is like, yeah, okay, I'm going to finance some of this. I'm going to pay for it. I'm going to go all in. But then for the rest of my life, I'm going to have probably very little dental work.
Yeah. I mean, you're kind of just on a maintenance phase right now, do your daily routine here at the house and then come in and see us a few times a year to get things clean. And that's probably all you're ever going to have to do again. So, and we've focused so much on, all these things we've been talking about as far as airway and neck and symptom relief and all that, kind of the icing on the cake in these situations, and not at all why they're done, but you got a pretty killer smile right now too.
Yeah. I'm not mad at it.
So, I mean, aesthetically, there's so much improvements that can be made at the same time. So you look better, you feel better, and it's kind of the best of everything we have to offer.
Yeah. Well, it's funny because I don't know. I don't look in the mirror that much. I wasn't really concerned about the visual appearance of my teeth. They were relatively straight. I mean, a bit yellow and kind of short in stature. But now it's funny because when I see photos of me smiling before I had this work done, I go, oh my God, like I had these tiny little funny looking teeth. And if I closed my jaw, my bottom teeth were totally disappeared because now I'm realizing like how far back my lower jaw was.
So here's something that would be interesting. If you can find a picture before we did this of you without any facial hair. Okay, so you can really see your face. And then you had one now, same thing without facial hair. What you're going to see is a tremendous change in the shape of your face. So sometimes we'll talk about what we call an instant facelift or non-surgical facelift. Because when you think about it, we're changing the dimension of the bones of your face and the position of them, which many times kind of tends to support your skin better and change the overall shape or dimension of your face. And so we've got before and after pictures that you would look at the same person and not even think it's the same person, just because of how much the shape of the face has changed and improved. You notice this a lot on people that have what we call a very deep bite. Their overbite is, if their teeth are together, you can't even see their lower teeth because they fit so far under the upper teeth. You change that face and get it back in the right dimensions and put, great looking porcelain teeth on it. That change, it truly looks like they've had some kind of plastic surgery, because it takes a face that is just kind of scrunched together and opens it back up and allows the cheekbones to come out and the shape of the jaw and all this kind of stuff. It's dramatic in the difference.
It's funny. I kind of forgot about that, but I have noticed that also in photos and just looking in the mirror, like just the shape of my jaw, like my jawline is much more pronounced and square than it was, which I never realized I had like a sunken chin or something, So that's you for your whole life. You don't really think about it. But funnily enough, I mean, of course, like if I haven't seen someone in a while, they're like, oh, yeah, your teeth look different. I mean, some people do notice that. But I have had many people go, "Hey, you look different. Did you lose some weight?"
All the time.
And it's like, well, I did lose some weight recently, but even apart from that, and I think what it is just the change in the shape of the face. It's just a different, there's like a different kind of bone structure going on in the face. So it gives the illusion that you're a different weight. And for me, the weight that I lost was relatively insignificant. I don't think would it change the shape of my face as much as moving the jaw, the lower jaw forward.
That's exactly right. And we'll have a lot of times where I'll tell people the best compliment that I can get, because this has happened on previous patients, is that they'll come back and say, "Yeah, I saw my friend, hadn't seen him in a while," and they're like, "What's going on here? Did you lose some weight, or did you change your hair color? I mean, what's been working out? I mean, you look really good. So they know something looks good, but they don't immediately know, oh, you had your teeth done. It's just because it fits shape-wise and color-wise and just kind of naturally into their appearance, improving it, but at the same time not standing out to the point that they've got the teeth that are just glowing first thing you come in the room.
Yeah.
So it's a way to kind of change all that, but do it in a way where it doesn't necessarily stand out so much. It just kind of fits you as a person.
Yeah, I mean, that was my goal. It's funny looking back, one of the most challenging things about the process, and you remember this because I brought Allison with me to your office, was picking the damn color, because it's like, I don't want my same old yellow teeth that were just, you're never going to polish that yellow out because it's coming from the inside. I didn't want that, but I also didn't want them super bright white and really fake looking, So we went through this whole thing where I brought Allison in and I said, because she has really beautifully, naturally white teeth. And then so I brought her in and I said, yeah, Kevin, I just pick the color that looks like hers, But then when we put the sample porcelain teeth up to hers, it made hers look kind of gray in comparison, I was like, oh my God, this is so hard. I got pretty neurotic about it. So thank you for your patience.
Yeah, no.
Because you want an outcome that is the most natural as
and that's the hard part, because people will tell me, I just want my teeth to look natural. That's completely different with every person you talk to. What's natural to you is not necessarily natural to me. And so figuring out what natural is like a challenge I have every day. But, just with more questioning and spending time and being patient and kind of working through it, fortunately, we pretty much figure out what it is and come up with pretty good results that way.
Yeah. Well, we did it. I'll be damned. I mean, I'm happy. Another thing about it too, I mean, aside from aesthetics and just being able to get more air and better sleep and all of those other things, but I mean, I got to say, one of the massive benefits is just my ability to chew food.
Sure.
It took me a while to relearn, right?
Yeah.
Because your jaw's in a different place. And,
Yeah.
that takes, I don't know, 2 or 3 weeks or something. You kind of figure it out. But I notice now, I'm just like, oh my God, all these years I've had a really difficult time actually just chewing a steak or whatever. It's just shit would get caught in my teeth. I'd have to always have toothpicks with me because my teeth were so jagged. If I ate beef jerky or something, I mean, it's like an hour-long project just to get it all out of my teeth afterward. So there's also, I think, just from a nutritional standpoint, I'm able to better masticate my food and break it down before swallowing. It's like my grandma used to always tell me, chew your food, your stomach doesn't have teeth, and I'm like, for many years, I didn't have a choice. I couldn't really chew my food very well because there wasn't enough strength and enough, actual substance to my teeth to do that.
So think about it like this. You take that inability to chew good, that's going to affect the choices that you make for your diet. Typically less healthy choices.
Yeah,
things that are
foods.
more processed.
I'm eating yogurt
softer,
and baby food.
That's right. So you're get back into that old issue again.
Yeah.
But there's a lot of kind of hidden benefits with that. That being one, you wouldn't necessarily think of that as the first thing, but it's a real result.
Well, tell me about the other part of the preparation. When I first signed on to go through this process, you guys sent me home with this device. I have it in my office that's like kind of a cervical spine decompression sort of thing, right? That pulls that up. So I was given instruction to do that. And then you also gave me kind of a movement program, some different stretches and things like that. And then I had the wherewithal, as I said, to work with Alex, and he came with me to a couple of my visits with you, and then you guys had a massage therapist. So I added on an extra component of just manual therapy and stuff to really create the most stable foundation for the new bite. But you guys also had a lot of other physiological kind of exercises and devices and things like that too. So maybe explain some of the other things that go into building a new jaw position and a new bite, but making sure the rest of your body catches up to support it.
Yeah, well, in keeping with this kind of overriding theme of not just working on teeth, but addressing kind of this whole body approach, the thing that we've talked about so much already is cervical neck posture, the position of your head as it relates to the rest of your body, and getting that aligned as optimally as we can. And so one of the things that we have is a device called the posture pump.
That's it. Yeah,
Okay?
yeah.
So the posture pump, and it's basically, like you said, it's kind of a cervical neck traction. But the goal with that is to restore what's called the proper lordotic curve. So your neck vertebrae should not be straight, but there should be kind of a reverse C curve to it. And when that happens, then we're able to get our head back in the proper relationship to your shoulders and your hips and on down your body. So the posture pump works to help kind of position your head and get your muscles to adapt to a more optimal position. Combine that with the exercises that you had as far as stretching, strengthening, range of motion type of movements with your neck is an effort all to get that head position as good as it can be. So then we're not trying to hit a moving target with our bite, because here's a good exercise for people. If you're sitting or standing, whatever, just looking straight ahead and you bite together, feel where your bite is. Now drop your head down and bite again. Your bite's in a different position. Put your head way back, bite again, your head's in a different position. So your head position plays a huge role in what we're doing in trying to restore a good bite. So if we can get forward head posture back where it needs to be, if we can get some stability and repeatability of where that head is when we're working with changing the bite, it's at that point then our results of the things that we're doing, in that change are going to be more predictable and get to good results that much faster.
Okay, cool.
Yeah.
Yeah, I like practices, whether it's in dentistry or otherwise, that are comprehensive and kind of thinking about seemingly unrelated parts of that. So when you guys sent me home with all that stuff, I was like, oh, this is smart. And I was pretty good about my compliance with it too, because, when you're spending time and money to do something that's going to be a lasting change in your body, you want to go all in, or at least I want to go all in and go for maximum results.
And sometimes we'll have people come back and we're talking about, how they're feeling. We have little forms that we kind of track the progression of symptoms and stuff. And maybe something's not right. Inevitably, you've been using your posture pump, working on your neck. No, I really haven't. Okay, well, and we told you before, there's only certain things that I can do, but I've got to have your help and a lot of homework to get the rest of this done. You did it, had great results. People like certain trained physical therapists, people like Alex that understand body alignment and manipulation and stuff is such a huge benefit for me, because now I'm working on something that's stable. Again, it's not, like I said before, it's hard to hit a moving target on this stuff. And if your head's all over everywhere and things aren't stable from that standpoint, then the bite adjustments that we may make initially are different 3 days from now, because your head's not staying in the same place. So there's multiple pieces of this puzzle. It's not me. It's not just the things that we're doing, but I've got the ENT, I've got the physical therapist, I've got the myofunctional therapist, I've got the tongue release guy. I've got multiple people on our team, because those are things I don't do, I can't do, but I know the importance of them. And if I don't have them, then my results aren't going to be what they should be.
Yeah, that's a great approach. And I wish more people in medicine in general understood that team effort kind of approach, right? You find that so many specialists are siloed into their own area of expertise. And then you have a patient who has a desired outcome working with just one of them, but there's often contradictions between each person that they're dealing with, right? So it's like you go see the orthodontist, they're going to tell them something, then you're going to say, and then you have the body worker, the manual therapist, your ENT, they're all kind of like in their own segregated belief system. And they just kind of, for some reason, I guess just inertia, people just kind of stick with their expertise and discount the other players involved that could have a huge impact.
I mean, they know what they know, and outside of that, for so many providers, it's just they don't take the time or make the effort to learn about other things. But which I think is one thing that's unique with the people that we've kind of brought together is everybody understands what the other one's doing, and the importance of it, and how it relates to the overall picture for the patient. So not too many times do you find that in whatever area it is.
That was one thing that I really enjoyed about working with you guys is there was no resistance to me having Alex come there and do adjustments before you guys. But yeah, I was like, oh, and he even said that too. He's like, you're dealing with someone who is going to do a good job when they're open to other people coming in. Because oftentimes practitioners of all sorts get threatened by the client bringing in someone from their team, right? And they don't want anyone from the outside kind of interfering with that process. So I thought you guys were like not only okay with it, but like, yeah, please bring them every time.
Yeah. No, I think that goes back more to maybe the insecurity of the particular person in case what he's doing isn't right or doesn't work or contradicts the other thing. It's just so they don't want to deal with it. I just you saw like with Alex, I said, bring him every time. I want him here because I know that what he's doing is going to make my job easier. So why wouldn't I? Right?
Yeah, absolutely. Yeah. Well, I'm glad that you were open to that. One other thing when I came into the consultation, with talking to Bo, who is a great member of your staff, and she's kind of laying out the options and all this stuff for me and talking about my symptoms and the different potential benefits of this procedure. And there were things like you mentioned the non-surgical facelift. She said, this is just an added bonus. It's not why we're doing this, but the shape of your face is going to change, et cetera. And then she said, I explained that I had pretty problematic tinnitus, and she said, listen, I'm not going to make any promises, and it's not why we're doing this, but it's a very common outcome that people that have developed tinnitus either have it diminish as a result of moving their bite into the right place. And in many cases, it also just totally disappears. And so, I didn't get hung up and attached to that idea, even though I would have loved that outcome. In my particular case, I haven't had any change for better or for worse with my tinnitus. Who knows what the cause of it is? It's such a strange thing to diagnose and strange things to fix, but maybe speak to some of the patients of yours for whom that has been alleviated, and how is the bite being in the wrong place related to the tinnitus and different ear issues that people have?
Ears they're a thorn in my side because
yeah, me too.
They're so difficult to have any kind of predictability with them. Because, as Bo was mentioning, we've had patients that have had years of ear-related issues, whether it be tinnitus, dizziness, congestion, whatever it is, and we go through this process and the symptoms are completely relieved. And then we've had some that, there's a little bit of improvement, and then, like yourself, it didn't really change too much. So why? Because basically the same process has happened in each case. The relationship of how bite and jaw position could be connected to ear issues is simply this. If you ever can look at a CT or a skull or whatever, if you'll look at the side where the jaw joint connects into the head, it's right in front of the ear canal. It's separated by a paper-thin piece of bone. And through that bone, there's also a nerve that comes from inside the ear to through the bone and inside the jaw joint itself. Many times, jaw position that's related to TMD problems is related to the position of the jaw within the what we call the fossa. So if the jaw is pushed back against where the ear is, and that area is compressed and very tight back there, then there's more likelihood that there's ear issues. But as we were talking about before, the process of this bite-changing jaw position is the jaw opening but coming forward. So as the jaw comes forward, it decompresses from that posterior portion of the fossa where the ear and the little nerve come through. So if we create more space and take the pressure away from that, then that's theoretically how we get improvement in these ear-related issues. Now, as we've talked about, sometimes it works, sometimes it doesn't. Why in this case and not that case? I have no idea. And ENTs have no idea.
When it comes to tinnitus, no one really has any idea other than, it's related to hearing loss, or maybe you had an infection or a drainage issue, or being exposed to, loud noise,
super
damage. I mean, there's like so many different contributing variables.
Right.
The only thing it seems like everyone agrees on is that it's really a brain thing, because your brain is, missing the ability to interpret those high frequencies, that high range. And so your brain is then producing what it seems to be missing, so it's like, it's just one of these days, someone's going to figure it out. I'm hopeful, I'm like, all right, come on. I mean, I've tried stem cells and lasers and all kinds of different things. And, some days it's worse than others, but it is a really complex issue, and
it's, as you said, it's just so multifactorial. There could be this or that or this combination, and just never ending almost.
Yeah. And you guys recommended a great ENT here that I saw, and I've seen a couple others, and, they look at everything. Oh, we can't really see anything wrong.
It's okay.
And there it is, so it's just kind of one of those things you have to learn how to, for me, just relax about it and just learn how to adapt. And hopefully at some point someone figures it out.
Yeah.
My dad's been doing something called, it's called a linear, I think. It's a new sort of technology that emerged, I believe, out of Germany. And there's like 15 audiologists that have been chosen around the United States to get trained and use this device. And he's had some success. It's been 2 or 3 months.
For tinnitus?
Mm-hmm.
Really?
Yeah. It's interesting. The audiologist figures out what frequency you're hearing, and then this device plays that frequency in your ears while you have what looks to be like a TENS unit that clips to your tongue. And so it zaps you while you're getting that frequency. And there's something about the way that it stimulates your brain to calm down and stop overcompensating for the lack of that frequency. Yeah, but they have a wait list, and so I'm signed up for whenever someone in Texas does it. So far, no one does. But yeah, I was thinking about if he still stays on track and his keeps getting better, because we bond over our tinnitus misery.
Right.
Every time we talk, how's your ears? And I'm like, mine are worse than ever. He's like, mine are getting better. It's been like 3 months. So.
I want to check into that.
I'll send you a link to it. Yeah. But it's out of, and I've done a lot of research on this, and obviously interview brilliant people like you all the time. And this seems to be, in terms of the clinical trials and the results that they've been able to prove, the most viable thing I've ever heard of. So I'm looking forward to trying it. I forget how many people were in their trials and stuff, but they had, I think, an 87% success rate.
Oh, wow.
Pretty good.
That's
and
big.
It was a rigorous trial. I mean, it wasn't just,
a couple of people.
It was like a legit clinical trial that they did. So I looked at some of those numbers and was like, shoot. I mean, even if I got a 10% improvement, I'd be happier, to get rid of it completely. Oh my God, it'd be like reborn, So you're obviously located here in Texas in Westlake. For those unfamiliar with Austin, that's a really nice area of the city of Austin. And, this was kind of an involved, in my case, since we did the whole meal deal, kind of an involved process. As I said, there were multiple trips back and forth and things like that. What percentage of your patients are people that travel in from other states, people that don't live here? I know you work with a lot of pro athletes and high performance people.
Yeah.
How does it work when someone isn't local?
It complicates things. I mean, it really does. I mean, you can imagine in your case, which we'll use you as worst case scenario, how many trips did you see me through the entire process? I mean, it was a lot. And so for people out of town, sometimes that's the limiting factor, that they just can't arrange to do the treatment, because of logistically, it just doesn't work. So sometimes in people like that, there are options, less involved, the result not being quite maybe as optimal, but you can do this and get some improvement, and here's kind of what that would look like. So we try to figure out ways to do it, but sometimes if the situation calls for XYZ and you can't do XYZ, I don't have anything else for you, so it makes it tough. I had at one point, before I lived here in Austin, it was in Tulsa, Oklahoma forever and ever. And a guy who found me somehow from New Jersey and had, a lot of TMD problems. And he had been to this, big name guy here and then someplace else. And he'd been all around trying to get some help. And he found my name, came in, we had some initial discussions. And we started him with the orthotic phase, and he started to get immediate improvement. But he knew, if I continue on with this, it's going to be a lot of appointments. So he just moved to Tulsa.
Oh, funny.
He just sold his home, moved to Tulsa, stayed a year, and just to make sure everything was good. And then when he was done, he moved back. Now, obviously, not everyone can do that, but
that's commitment.
That's commitment. Yeah, and fortunately, things worked out well for him, and he got some great relief from things. But the more involved it is, the more necessary, I guess, it would be to be able to make the commitment to being here multiple times, because it's a process over several months, and there's trips involved, and there's no way around it. If there were, and we could condense things or take some shortcuts, obviously we would do that. But there's certain things with this protocol that you just can't cut short.
So I think my treatment was prolonged by a bit because I had a couple bouts of travel in the middle of that, where I had an appointment that would have sped it up by a month or something, but then I'd be gone for a week here, gone for a week there. So I would miss appointments. In my case, doing the whole deal, the whole full mouth restoration, moving the jaw alignment, bite, and all that. If I had not left town and was just here, what would have been, a typical time period for someone going all in?
So let's take this start to finish in a normal scenario, and we'll still start with multiple problems. The end result's going to be full mouth rehab. Okay. So start with the orthotic, like we talked about, and that's typically a 6 to 8 week process. At that point, we do a little procedure called a bite transfer, technical stuff, not to be concerned about, but it's the next little step. Then you're back for me to work on the teeth. Okay, you leave from that appointment, and you've got temporaries top and bottom in the same bite that you've been in, and now we throw in the aesthetic part of shaping the teeth in a way that's kind of the proposed final result. But since the temporaries are temporary, they're plastic, we can change the shape of them. So we look at some pictures, we think we want the shape to be a certain way, we make the temporaries that shape, now they're in your mouth, how does it actually look? So we can change things, we can flatten an area, we can round a corner, we can change things as needed until it gets to the shape that you're really wanting and expecting. So then the finals duplicate those changes. You're in the temporaries for about 3 weeks. You come in and take the temporaries off. We try in the new porcelain teeth before they're glued in. If you'll remember, we sit you up, and a very important part of this process is for you to approve the shape and the color. Okay, because once they're glued in, I can change some things shape-wise, but I can't change the color. So I don't put things in until my patients say, yes, that's it, I love it, put them in. The reason I've become such a stickler on that is years ago, before I was so much that way, I ran into a situation where we put the case in and still had the patient kind of look at things, but didn't really emphasize the importance of it, and came back a week later and said, "I don't like this color."
Oh man.
Like, what am I supposed to do? You said you liked it. Now you're telling me you don't like it. I can't change the color. So it just kind of creates some, a contentious situation there. So it's important for me, important for the patient too, to be aware of, hey, this is the day right here. I've got to make a decision. I like this. Do I not? So you bring your wife, you bring your husband, you bring your best friend, get their input on things, because once they're in, they're in. And so we get that approval, put them in, and then there's several bite adjustment appointments to just make sure everything fits right and feels right and all that kind of stuff. So start to finish on that in a normal situation can be 4 months. That's a good range. A lot of that time, we're not necessarily doing dentistry, because there's some periods where, like when you have your temporaries on, that's between the time that you get them and the time we put them in is usually about 3 weeks. So you're just going about your business during that time. But a fairly typical scenario there would be start to finish around 4 months.
Okay. And mine was probably, I don't know, 5.5 months or something like that. I think because those couple trips I took kind of slowed things down. I remember an interesting sensation after I had been wearing the temporary orthotics, which of course had the jaw in a new place. So my bite was totally different. So I kind of, didn't have that overbite anymore. My teeth meet like they meet now. It was the weirdest feeling in the appointment when they were taken out and my original teeth were back.
Yes.
And then bite and be like, what the hell is such a weird feling? Because my nervous system had already gotten used to the new bite position, and it was so trippy. Kind of closing my old native teeth together. I was like, what the hell? I can't even touch them together. It's so weird.
As weird as the orthotics might have felt going in, then they become normal, and you take them out, and you go back to what was normal, your own teeth before, and it's like, what are these things? You don't even recognize them, and they don't fit together anymore.
Yeah,
bite position has changed. They feel small and little, and like, what is this? But, it's pretty common.
Yeah, it was a weird feeling.
Yeah,
and I didn't want to look at them. I don't know if you guys gave me the option, but I didn't want to see my old teeth once I'd gotten used to seeing. The orthotics look kind of funky because they're not shaped as naturally as the final teeth you put in. But it's like I never wanted to see the old ones again because it just tripped me out. It was an interesting process.
Too many memories.
Yeah, it's just interesting. You go through your whole life and you're used to looking in the mirror, chewing food a certain way, or your ability to talk and things like that. Like I remember even when I first got the orthotics, and maybe by the time I got the permanent ones, I think I had learned how to speak, but I'd be recording these podcasts and it was difficult for me to say S's, and I kind of had to learn how to talk again because it was such a dramatic change in just the mouth feel and, you said, the space that you have for your tongue and all that kind of thing. It was definitely a funny adjustment for me as someone who makes my living talking.
Isn't it interesting, though, that after a short period of time, you just kind of adapt and then you're able to do it?
Yeah. And that's what you told me. You're like, I remember when I got the temporaries, you're like, it's going to feel real weird to talk. Chewing's going to be weird. I think I was on smoothies for a couple of days because I just couldn't figure out how to chew food. And I was a little disconcerting. But I remember, no, Dr. Winter said, it's, you're going to get used to it. It's building that muscle memory. And now, now it would feel weird to go back to how I was, which is, it felt so kind of limiting and dysfunctional.
Yeah. It's kind of interesting too. At different times through the years, I've had situations where, actresses or whatever will be in, and they're in the middle of a process, but in their temporaries, they've got a photo shoot or they're doing something, in front of the camera, and the worry is always about, how are the temporaries going to look, and they actually go through the process. No one knows any different because the temporaries, once you get to the final temporaries, not necessarily the orthotics, but the actual temporaries, they can look pretty good. And especially if you're not just right up close on them, But they're so worried about how this is going to come across, but everything worked out great, and no one knew any different about it. So
Yeah.
it was kind of kept me awake at night for a while, hoping that it was going to be that way. But sure enough, it turns out good.
It does, yeah.
Yeah.
Oh, well, I'm stoked. You guys took such good care of me, and yeah, that's why I wanted to have you on the show. I mean, I'm not the only one that's having the kind of issues that I was having. I'm sure it's quite common.
Yeah,
So,
the thing that we found, and I mean, you've been in the office. We've kind of set it up a special way, and have we've got a full-time massage therapist, and we're doing things to address issues way differently than your normal dental office. And whether it be the environment or the services that we offer, but it's an effort to serve a group of people that are kind of stuck with no one to help them, because general dentistry really can't help them. Medical profession can't help them. A common option for people that have TMJ, like we talked about before, is to go have surgery. Well, so many times the surgical process in doing that makes things worse, because it's not addressing muscles, like we've emphasized, is really the key to this. So I've kind of found a niche that I'm able to serve and help people in a way that not really anyone else is doing. So, I mean, it's not only rewarding in for myself and from a professional standpoint, but I just know that we've had so many life-changing situations where people have been so thankful for what we're doing. It just makes it kind of unique and special. So
yeah, very much so. And I want to let the listeners know again, the show notes will be lukestorey.com/winters. And someone from your office mentioned to me that you guys will do free consultation for people to hear this podcast, which is cool. So thank you for doing that. We'll put all your contact information and all that stuff. But yeah, I don't have anyone on the show, obviously, that I've personally worked with that I wouldn't recommend. If I have a negative experience, then we're not going to do a podcast and potentially send people into where I didn't have a positive experience. But it's just been great all around. I'm super happy with the result. And, I mean, I had to do my part and show up to a few appointments. But other than that, it's like I'm good to go now. I feel a huge sense of relief that not only many of those symptoms that I talked about are alleviated, but I also just don't have to worry about it anymore. Just like I'm on the maintenance train now, which is
cruise control now.
Yeah, I mean, I'm about to turn. What am I about to turn 53? Like, I don't want to keep dealing with my old teeth. I mean, it was just a constant problem. And also, when you have something like that going on, there's I had this kind of minor sense of impending doom that it's like eventually these things are going to break down to the point where they're not usable, and so you're kind of just. Yeah, I'm kind of just like sooner or later I'm going to get to a point where I really have to address it. And so I kind of put it off. And there's a huge sense of relief for me to finally just go, okay, I finally just took the plunge and dealt with, the time and the expense of doing it. And now like I'm golden. And, my case is obviously more extreme than some people where you might be able to work with, an orthodontic sort of situation.
Yeah, like we've talked about, there's a lot of different ways that we can handle this.
Yeah. So I just happened to go for the most extreme because that's what I needed, but it turned out well. Last question for you.
Yeah.
Where do you see, your niche of the dentistry industry going? You're out there training other dentists how to do this. You got a network of 10,000 people around the world that are interested in this. I was totally unaware of this, and I'm kind of in the alternative health space and have my finger on the pulse, I like to think. Do you see this as something that your average neighborhood dentist will eventually start to adopt? Are you hopeful about, public awareness around these issues and that there are other types of dentistry like the ones you practice?
No, that's a very good question, because, the trend inside dentistry is for a lot of corporate involvement in buying dental practices. And so now what you have in many situations is a for-profit corporation that owns multiple offices, and they try to typically streamline operations in a way where It's the most predictable from a corporate standpoint. Not necessarily what's the best thing for dentistry, the best thing for the patients. It's just how can we structure these businesses to make as much money as possible, right? And in those scenarios, the typical doctor who's there is a younger doctor, many times not long out of school, who is in there just trying to learn the trade, and how to do things. But then they're also limited in what they can and can't do based upon these corporate principles. Now, there is no dental corporation that I'm aware of that has any interest or has expressed any desire to incorporate anything that we're doing from a TMJ standpoint. Now, that still leaves the people, the dentists who own their own offices that aren't associated with that. It's, I've been involved in the teaching aspect of this for 26 years. It's a struggle because it's so different than what everyone knows. And I think it's unfortunate in that there aren't more dentists who are trying to be really great at what they do. For me, from a personal standpoint, everything I've done from the time I was young to now, I'm trying to learn and grow and be the best at whatever it is. Whether that be from a health standpoint personally, whether that be from a professional standpoint and how I run my business, whether that be whatever it is, I want to strive to do it better, and that's just how I've kind of been built. But I don't see that a lot in the profession as a whole, and so the number of dentists that we've been able to reach, although over 10,000 worldwide and that kind of stuff, is a fraction of the total number of dentists. And so do I see this becoming more widespread, more people doing it, kind of taking over as it should? I don't see that. I think it's going to be a very niche type of situation where you've got one guy over here, you've got another guy in that state, but having the ability to have multiple providers doing this kind of stuff, although it's what it should be and what I wish it would be, I don't think we'll ever see that. So the combination of the corporate side, the inability for a lot of dentists to make the time and effort to be better in this field. Now, maybe they're better in something else. Maybe they're better at doing implants or whatever, but in being better as far as TMJ kind of stuff goes, there's just not a lot of them. And so unfortunately, again, I just don't see this becoming very mainstream at all.
Well, maybe this podcast will make a little dent in that.
I mean, hopefully. Yeah.
I mean, that's, one of the great things about social media and independent media now is you give people that are kind of in a niche area of expertise in whatever field a bit of a platform.
Yeah.
And, next thing you know, public awareness grows into public demand. And then,
well, and ultimately that would be the thing that would drive it. If the public in general could see the benefit and experience the benefit, then they would then drive the demand for more providers to be there, right? But as you said, there, from a media standpoint, any little thing can help. So, this type of thing, it'd be great to have some documentary on Netflix about this stuff.
Right.
It's things to that level, I think, is what it would take over a period of time to really get the word out. Because, look, I've been specifically doing this neuromuscular dental approach since 2000. So I've got 23 years of experience behind me. It works. There's no question. Now, you may go into the more typical dental provider that hasn't had any of this training, that still relies upon the same thing they were taught in dental school. and they'll sit there and argue with you that there's no way it could work. You can't do that. It's impossible for that to happen. Like, bro, I do this every day. It works. I've done it for 23 years. It works. Why are you battling this? Just because it's outside your realm of thought doesn't mean it's wrong or doesn't work. It works. And it's not just me. It's all of us that are doing this stuff. So the protocol is there. The results are there. The proof is there. We just need more people to be able to learn about it, benefit from it, and help. Like I said before, help a group of people that is kind of stuck with no one to help them.
Well, I'm an advocate. I'm going to tell the world widely that it does work. I'm living proof. I'm hopeful. I mean, not just, this podcast has a finite reach. It's going to reach a few tens of thousands of people, and many of them will probably come see you or someone like you that has this specific area of expertise. But in the realm of dentistry, over the years that I've been into, holistic medicine and this kind of stuff, I have seen a much more broad awareness of biological dentistry and holistic dentistry, right? When I first got into it, I mean, the dentists that were doing mercury filling removals and didn't use fluoride and all this kind of stuff were very obscure, and there were very few of them. And only people that were really into alternative health kind of even knew that category of dentistry existed. And now I get messages from friends all the time. Hey, I'm looking for a holistic dentist, biological dentist. People know what it is, and they know that there's other ways that you can care for your teeth other than,
and I'll tell you, just to the point of what I was saying before, the population, people, your friends, they're the ones driving that, because dentistry is not pushing it.
Right.
Organized dentistry is not pushing it.
Well, it wasn't that long ago. Dentists were losing their licenses for speaking out against the mercury fillings and all this stuff, I mean, you had to be a real risk-taking rebel of a dentist to even be honest about some of the malpractice going on, and the unnecessary kind of procedures and things like cavitations and root canals and people just yanking out teeth for no reason and getting infections in there. I mean, all this kind of stuff is going on. It's a huge problem in the area of dentistry. And it's going to take people that start to educate themselves and get information about that to help incentivize dentists to go into the holistic area, or in your case, into the TMJ and all the things that you're into. So I'm hopeful, but at the same time, it is slow if you look at the big picture. Like, how many years did it take? And still, there's millions and billions of people out there that are still putting mercury in their mouths, and dentists that are standing by it and just ignoring, the risks involved with that. So it's a slow process, I think, of waking people up on the consumer side and the practitioner side. But, we're making our little dents here and there, and hopefully,
just keep chipping away at it.
Yeah, exactly. Yeah. That's kind of my mission. Last question for you is this one. Unrelated to dentistry, probably, but who have been 3 teachers or teachings that have influenced you in your life? Could be a philosophy, a person that have made you who you are.
Oh, very good. I think from a dental standpoint, the guy who started the institute where I've taught all these years and am now doing the courses for him since he's retired, his name's Bill Dickerson. So from a dental standpoint, definitely Bill. I mean, there's been others, but he's probably the main one. Certainly, looking at my entire life, I think God. I've always had a great faith and look towards that for reassurance, for guidance, for all the things that you rely upon your faith for. Third one. Well, maybe I can. This is somewhat of a cop-out, but I'm going to go with it because I don't know that there would be a singular person with this, but I would say that sports and athletics in general, and the more importantly, with inside that, the mindset, the structure, the dedication, the ability to, as I was talking about before, strive to be better and to improve, and I'm pretty competitive to win. I think that background there is something that's with me daily. And So within that realm, multiple people in the sports world, but just kind of that. I mean, that's me. I want to be the best. I want to win. I want to. That's just who I am, and that's where it came from.
Yeah, there seems to be in your line of work, especially as you've specified on this area, a lot of discipline involved, right? And you don't have to be doing it the way you're doing it, right? You could just ignore everything you know and just be putting in fillings and doing all the regular,
all day, every day.
Drill it and fill it and making a good living doing that. So, it definitely makes sense that you've gotten some of your tenacity and discipline and dedication from, your experience there.
Yeah, for sure.
Awesome, man. Well, thank you so much for doing great work in the world. Thank you for coming to hang out with me today. And more than anything, man, thank you for fixing my teeth, Kevin Winters. I'm so stoked to not have to worry about these damn things anymore.
Dude, you look awesome, man.
Thank you. Yeah, I'm really grateful that I, asked Kyle about it. And I think Aubrey had recommended Kyle to you. And so there's kind of a lineage of us here in Austin that have sorted our situation out thanks to you. So really appreciate the great work you do.
My pleasure.